Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will talk to Shelbourn Stevens, Novant Health Brunswick Medical Center's president, to learn more about the partnership opportunity with New Hanover Regional Medical Center. Then, Dr. Laurie Tachman of Novant Health Pediatrics Brunswick will offer some tips for parents to consider in regard to the pandemic. And finally, we will meet Dr. Tim Murphy of Novant Health Family and Internal Medicine, South Brunswick, and Mary Crichton of Novant Health Oceanside Family Medicine in Bolivia. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Shelbourn Stevens, president of Novant Health Brunswick Medical Center. Shelbourn, welcome back.
Thank you. It's good to be here.
It's so good to have you back. I always love our conversations.
Me too.
And you always have such great news for me. So today, I want to learn more about the possible partnership with New Hanover Regional Medical Center. So can you give me the basics?
Sure. I'm very excited about the possibilities as we move forward. We've always worked with New Hanover. That's
Right.
where the majority of our transfers go for a higher level of care. And we've had their cardiology on staff and supporting Brunswick County for years. So I'm really excited about just growing healthcare services for Southeast North Carolina and the region.
Absolutely. I am so excited I can't hardly contain myself. What are the next steps in the process?
So the commissioners voted 4-1 to move forward with the letter of intent.
Yeah.
So that's really what everyone is working on right now. And then what would the partnership look like? And then that would then come back through the approval process at a later date for a final approval of what it may look like.
Well, that's a big job. Locally, Novant Health Brunswick Medical Center has worked really closely with New Hanover. And what can you tell me about that? Will it continue to grow? Will there just be more?
Absolutely. As I mentioned, we've had the cardiologist, Cape Fear Heart Associates,
Right.
for years.
And the helicopter.
And the helicopter, we did that about a year and a half, almost 2 years ago.
Yeah.
And that has really just been such an asset to the community, not only the hospital. We have so many stories of people having a stroke in the community, and they bring them straight to the helicopter. We get them to New Hanover, and they get interventional treatment in a very timely fashion, and it's saving lives is what
Absolutely.
it's doing. And so we have always been talking to them about growing more services with specialists, and excites me with the possibilities of even telemedicine. One thing about the pandemic this year is we've all started using computers and using telemedicine, so it's really gotten the community, the providers comfortable with technology in medicine.
Right. Well, I understand that UNC School of Medicine and UNC Health are also part of this partnership. So can you share a little bit about that?
Sure. So UNC School of Health has been at New Hanover for over 40 years.
Long time, yeah.
And after the responses came back, we reached out to UNC to say, we think we'd be a good partner together. And in just a few meetings, you thought we'd all been working together for years.
That's
so
great.
The excitement around growing the medical school and the presence of residents at New Hanover and possibly the region is exciting, and even some of their ancillary schools, being able to bring those to Wilmington. It's just so many possibilities that could come down the road.
And the residents that have come out of that program that we have hired within Novant Health, we have many already on staff, and they're they're so well trained, and it's so good that we can maintain that partnership.
Absolutely. It's a pipeline for Southeast North Carolina for future providers.
And we sure need that.
Absolutely.
We sure need that. So for New Hanover County residents, what do you believe this partnership would mean for them?
Again, it's growing services for the region. New Hanover is full all the time. They are an excellent, top-notch hospital.
Absolutely.
And when patients need that higher level of care, that's where they go to get it. So to grow the services that are there and to continue to add those services, but also around the region, how can we work together to get providers in the communities that don't have them? And that leads us towards health equity, making sure
Absolutely.
that there's health for everyone. And both organizations, New Hanover and Novant Health, when we started these discussions, we've both been working on it, and we have great ideas. So now partnering together for Southeast North Carolina to make sure that we have providers and clinics in these communities, especially where there's not transportation. Right. It really excites me to bring health care to those communities and those things. And the other big piece is our charity care policy at Novant Health.
And it's an awesome charity care policy.
It is. Currently, New Hanover's at 200% of the federal poverty level,
right.
and Novant Health is 300%. So we're going to be helping more people to seek health care and get the help that they need.
Yeah, and you hear more and more about health equity and charity care and the great need for both of those. And together we can really provide a great program for all the residents in Brunswick County and the surrounding counties.
Absolutely. The possibilities are endless.
Yeah, they are. You mentioned that there's a few more steps that in the process for this partnership. So for our viewers out there who might want to support you, what would you recommend that they do?
So they can go to our webpage, which is novanthealth.org/bettertogether to get more information and educate themselves, or they can reach out to the elected officials in New Hanover County and offer their support and why they think this will be a great partnership, or even email some of the PAG members and those type things to show support.
And I've talked to several physicians, and they're very excited about this opportunity. And it'll just open up doors for more specialties here, like locally. I think that will be the biggest thing for Brunswick County residents. What would you say about what they can expect? Will it change? Will it improve?
I think our services will grow with this partnership. Today, when we work on a lot of these ideas of working together with specialists, it takes a while. We have to get the attorneys involved and have agreements put into place, but when we're a true partner together, we can do things faster, and the services here in Brunswick County will continue to grow. We want to bring as many healthcare services locally as we can.
So I guess it will improve for both residents of both counties, and all the surrounding counties too.
Absolutely, that's the goal.
Well, this has been a great interview, and I know you can't share too much. I'm sure there's a lot of things going on. Will you come back when you can share more?
Oh, absolutely, we'd love to.
This is awesome. Well, thank you again for being here today. It's been my pleasure, always my pleasure. So we'll see you soon.
All right, thanks for having me.
You're welcome. Now, let's welcome Dr. Laurie Tachman of Novant Health Pediatrics, Brunswick. Dr. Tackman, it is so good to see you again.
So good to see you.
Thank you so much for coming. Yeah. And now there may be a few people out there who didn't see you the first time, so let's remind them about your education and your background.
Sure, absolutely. I grew up in Ann Arbor, Michigan, and then I went to medical school at Michigan State University.
Wow.
And then stayed in the Midwest and went to Indiana University and trained at Riley Hospital for Children. And when I finished up there, then moved to North Carolina in 1999.
Wow. Yeah, it sure is hot here now, though, isn't it, Lord?
Yes, it sure is.
Not like Michigan.
Yep.
So, let's talk a little bit about your clinic. Tell me about your pediatric practice in Supply, right?
Yes, absolutely. We are a general pediatric clinic. We see newborn through college-age children. And we also go to Brunswick Medical Center to see the newborns. We do procedures there, and we also do some procedures in our office.
Great, and it's located right off of 17. It's very convenient to get to.
Yep, right off of
Just
Highway
south
17.
Of the hospital a little
about
bit.
5 minutes south,
Right. Well, I know that, like me, a lot of grandparents and a lot of parents out there have questions now about their children and the pandemic. And as we get closer to school starting, what tips do you have to keep our children safe?
Yes.
That's a hard one, I know.
Yes, yeah. There's a lot of different variables there. So first of all, keep an open line of communication with your children. Make sure they're not too anxious, and you know, they understand that, you know, it's going to be okay. And there are things that are different now, and we need to follow different rules, but it's all right. And if they have any questions, they need to, you know, talk to their parents and just be consoled if they're starting to get a little anxious, you know, because they've been cooped up for a little bit as well. Also, going back to school, and always practice at home, lots of good hand washing, wear the mask when they need to, when it's appropriate, and try to keep social distance. In school, I think they're trying to keep about 3 to 6 feet in between the children. And if the child is ill, not feeling good, then they need to stay home. Right. So, and make sure they follow all the rules that the regulations now that the schools have. And so it's going to be a completely different way of going to school. So, you know, definitely go over with the children the new rules, wearing the mask, lots of good hand washing, try to stay about 3 to 6 feet. Right. Yeah, that's all good advice. During this time, I know the kids have been cooped up and people are starting to talk about play dates. And I'm not so sure how that works. How do you know your playmates are safe? So what tips do you have for parents around play dates? Well, first of all, with play dates, with your own family, if there's any family members that are in the high-risk category, that if they do get the coronavirus, it could be some real serious complications, I probably would not have any play dates at this time. Just do your best to entertain them at home and just have some fun adventures and activities, you know, within the family. But if everyone's pretty healthy, doesn't have any health concerns, that they can probably have 1 or 2, you know, close friends that parents feel pretty comfortable that that this other family has been a lot of variables that they've, you know, been doing their part and staying at home and not going out and about and not feeling ill. And if you feel comfortable with the other family, then absolutely, I think you can have some play dates. I would keep it small, 1 to 2 children. I would try to have them play outside, do some outside fun adventures, and you know, wear a mask if appropriate. Lots of good hand washing, and Well, let's talk a little bit about your office. Now, are you conducting well child visits in the office? Yes, we are. Okay. Yep, we've continued to see well child visits this entire time. Yeah, so in those who have felt uncomfortable with coming in, we've offered video visits as well. Oh, nice. And so you're still keeping up with the shot? Yes. Yes, the vaccines. Online I mean, on time and keeping up with the schedule. Right, that's very important. We're really trying. Of course, we're seeing the newborns in our office and the infants because they get the vaccines more frequently there. And we really don't want them to get behind. Right. So we're really trying to stay up to date with everybody. And even the older children, we don't want them to get behind, especially if they're going to be going to school or doing, you know. Yeah, you don't want to miss those. You don't want to miss the vaccines. For sure. If a child is sick right now, should they be concerned that it's coronavirus, or what should they do? Should they call? Well, if parents have any concerns, absolutely give their pediatrician a call. But the main symptoms that you're looking out for are a fever, cough, shortness of breath, sore throat, vomiting, diarrhea, rash, and kind of bloodshot eyes. Wow, that's a lot to watch out for. Yeah. But any one of those or any 2 of those, they need to just call and get reassured. Absolutely. Great. Absolutely. All right. Well, this has been great information, Dr. Tackman. For our viewers at home who are interested in scheduling an appointment with you, you are taking new patients. We are. Yes. And they can just call your office? Yes. Yes, and that phone number is? 910-721-4400. 4400. Great. Well, thank you so much for joining us today. It's been a pleasure to have you. Yes, and thanks for having me.
we all get through this safely, especially our kids out
Me
there.
too. Yep, thank you.
Thank you. Now let's welcome Dr. Tim Murphy of Novant Health Family and Internal Medicine, South Brunswick. Welcome, Dr. Murphy.
Thank you. Lovely to be here.
I am so happy to have you here. I know we were together last week touring and we had such a good time.
We did.
And so I'm really happy that you were on the show today.
Thanks.
So I know there are folks out there who haven't met you yet because you're pretty new. So tell me a little bit about your background and your education.
Okay. Well, I'm from Buffalo, New York, and I'm married to my lovely wife, Donna, who is my everything, times about 34 years. And we have 3 beautiful children, one of each, just kidding. 2 boys and a girl, and we have a 3-year-old granddaughter.
And what's her name?
So the granddaughter is Ivy.
Ivy, how
Yeah.
sweet.
Oh, she's a doll. She melts my heart.
I'm
anyway.
sure.
So
where'd you go to school?
Well, I got my bachelor's degree from the State University of New York College at Buffalo, also known as Buff State to Buffalo folks.
Oh.
And then medical school was in Kansas City, Missouri. And then I did a family medicine residency, which is 3 years beyond your doctoral degree.
Right.
And that was done in Niagara Falls, New York. And that was a State University of New York residency. So that's pretty much it. And so I'm a generalist, or as many patients would say, oh, just a family doctor.
Oh, no.
Yeah, okay.
Just.
All right.
There's no just in there.
Right,
Yeah,
well, thank you for that.
yeah, you do it all.
Well, that's exactly what, and I know this is one of the questions that I'm to field, why I got into family medicine, because I love having a broad-based foundation.
Right.
And that way, hopefully, prayerfully, humbly, I have an idea, no matter what someone comes in with,
Right.
Adult, child, man, woman, you name it, any patient coming in to see me, because I've got gray hair and it's real.
Me too.
Yeah, yours is nicer looking than mine. But I have an idea with,
Right.
again, whatever people present.
Yeah. You know what I like most about family practice is that it's generational. You might see the baby all the
Right.
way up to great grandma.
Womb to the tomb, as they say.
Yeah.
Yeah.
I think that's
don't
awesome.
deliver babies anymore. Thank you. I don't deliver babies anymore, but pretty much anything and everything else with family medicine.
Yeah.
And I love it. I just love it, especially connecting with the folks and hearing their stories
Absolutely.
that people very close with them may not have any clue about.
right.
But I get to hear a whole bunch in nanoseconds practically.
That's true. Yeah, that's true. Well, I'm curious. What brought you to this area? Why Brunswick County?
As I said, my wife and I have been married a little over 34 years, and when we were first going together, we came down from Buffalo, by the way, during blizzard weather. It was literally feet of snow. And we came down south, about a 14-hour drive to get to the coast. Holden Beach is where we ended up, and because one of my wife's friends, who was part of our foursome, she was in a wedding down here. She's originally from Holden Beach, and I could not believe that we were wearing T-shirts and shorts on the beach, not swimming, but
Yeah,
you know, this
sure.
is February, blizzard weather in Buffalo, and we come down here, and it's beautiful blue skies, sunny. So many, many moons later, my wife and I decided it was time to come down here.
Sure. Let's talk a little bit about your clinic. And I know you're crazy about your clinic, and I know you've only
Crazy
been
about
here a
it.
few months, but you absolutely love your clinic. So tell me about the clinic.
They're indescribably kind, gentle, dutiful, just magnificent human beings, and I am humbled by their humanity, I would say.
Yeah. And it's in South Brunswick, right?
Yes, ma'am. Yes, it's in Calabash. I'm sorry, the thriving metropolis of Calabash.
Yeah, and we call it South Brunswick.
Yes, ma'am. So it's South Brunswick family medicine and internal medicine in whatever order. But we have just a wonderful staff, as I mentioned, and I've thoroughly enjoyed working with them. Everybody is so helpful, so quick to assist with whatever I'm asking.
Right.
And it's usually something with the computer, of course.
Of course.
Yeah. But, clinically in whatever manner, they're just
it's
wonderful, wonderful people.
It's a great practice.
Yes, ma'am.
We're really excited to have them as part of Novant Health. So let's talk about coronavirus for a little bit. I know that you've probably seen some patients who maybe have delayed care because of the coronavirus, and that's not a good thing. So what would you recommend now to patients that are due for their annual exam? Is it safe to go to the doctor?
It is, to the extent that at the door, folks are screened for the coronavirus. So whoever is staffing the door, literally the front door of the clinic, they're questioning folks who are coming in for a doctor's visit, whether it's an acute visit because they hurt their elbow, or a routine scheduled follow-up for their hypertension, diabetes, cholesterol, and so on. And so people are screened. So to the degree that screening can assure a safe environment, that's the rule. Now, as I think most people realize, because there's been a lot of discussion about coronavirus, unfortunately, we don't know a whole lot about the coronavirus, but we know, and I'm sure most of the public knows, that it's a little too easy to contract that viral infection. That said, that should not delay anybody from seeking out their usual follow-up appointment or an acute visit or what have you. Everybody wears masks, and if there's any question about a given patient coming in, possibly having coronavirus exposure, then that's addressed then and there. The behaviors that everyone has heard about, they're called mitigating. But in other words, that which lessens the risk of transmission, we recommend highly, highly, highly. And please, if nothing else comes of this, masks must be worn, must. And I respect people's protest of wearing masks, and that's my right to behave the way I want. But in fairness to everyone involved, no one has a right to make somebody else sick. So I say that with due respect and love in my heart towards everyone, but you have to wear a mask.
Please wear a mask.
There's no way around it. And then you need to wash your hands, and always have some bottle of whatever sanitizer on your person or in your car, wherever you're traveling. You need to have that, and slather your hands and clean them properly. And finally, of course, social distancing. And those things work. They work. They work not just nationally, but internationally. And so they have to be employed.
Well, Dr. Murphy, it's been a pleasure to have you here, and I know that you're taking new patients.
I am.
And so we'll run a trailer along with the phone number so they know how to contact you.
Thank you.
And I wish you all the best. And
I'm grateful. Thank you.
You're quite
Miss
welcome.
June, I should say, has been extraordinary. And she has taken me on a number of tours.
You're so
One
funny.
was to Atlanta. No. But anyway, I so appreciate you. You have no idea.
Thank you. welcome Mary Crichton, nurse practitioner with Novant Health Oceanside Family Medicine in Bolivia. Mary, we are so glad to have you on the show today.
Thank you. It's great to be here.
I'd like to start today, as I usually do, learning about my guests and where they went to school and their background. So tell us where you went to school.
Okay, so I started out my career at Sandhills Community College in Pinehurst with my associates. And I was a nurse for several years and decided to go back and get my bachelor's degree. And I went to University of North Carolina at Pembroke. Then I decided that I wanted to become a nurse practitioner and got my master's in nursing at Frontier Nursing University out of Kentucky. Currently, I'm working on my doctorate, and projected graduation date is December of this year.
Oh, wow.
So, yeah.
That's exciting.
I love to learn.
Oh, we'll have to bring you back when you get that. That's great.
I love it.
So what made you keep going and becoming a nurse practitioner? Is there something that you really wanted to do?
Well, like I said, I just love to learn, and it just seemed like the natural progression of things, that I was able to help my patients in one aspect as a registered nurse, but I could do even more as a family nurse practitioner.
Yeah, that's what a lot of them say.
Yeah.
Yeah. Well, what led you to this area?
My husband and I were living in Moore County at the time, and we found a beautiful house here in the Ocean Isle. So we came here. It was going to be a vacation home and just somewhere that he and I and our family could come to relax.
Wow.
And we loved it so much. Fell in love with the area and the people here, and just decided to come here full time.
Oh my goodness, and we're so lucky you did.
We feel like we're the lucky ones.
Well, tell us a little bit about your office. Now, you're located right next to the Novant Health Brunswick Medical Center, right?
Correct, on Hospital Drive.
And you have a couple partners at the office, right?
I do. A couple of wonderful guys that are absolutely wonderful to me and to our patients, Dr. Smits, and of course Jason Honecker, who is a physician's assistant. They're both great to work with, great team.
They are. They've been on our show, both of them, and they are really sweet. So what kind of services do you offer? We
offer from age 6 years up to 100 plus. We do Medicare wellness visits and annual physicals. We also, some of the providers give trigger point injections. So if anybody has a question about any kind of services, they need to give us a call.
Yeah. Do you have any particular interests or specialties that you like to pursue in terms of healthcare?
Well, I would have to say that my whole career I've enjoyed working with chronic conditions, diabetes.
Sure, and there's a lot of that here.
Yes, COPD. So I have a huge interest in that. In fact, my DMP project is on diabetes. So I would think that would probably be my area of specialty. My area of specialty in our office would be women's wellness.
I knew you were going to say that. Well, are you taking new patients?
Absolutely. Absolutely.
Great.
We'd love to have new patients.
So if someone out there would like to call and make an appointment, how might they do that?
They can call us at 721-4100 or go on my chart if they're a Novant patient and schedule an appointment with us.
Well, that's wonderful. We're always glad to have another provider in the area, and I wish you all the best. Thank you so much for coming on today, and promise me you'll come back when you get your doctorate.
I would love to. Thank you for having me.
That will be awesome.
Thank you.
Have a good day.
You too.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
This is ATMC TV, your community channel.